Hi, welcome to my guest lecture. I'm Dr. Elijah Nielsen, and I have been invited by Ruth, the wonderful Ruth, to do a guest lecture on ethics, applying ethics to practice. I apologize for this setup. I know the camera angle is kind of funky. I'm kind of short in the camera. I'm an average size guy, and the angle is kind of skewed. So I know you're aware of those things. I know that's probably pretty annoying to you, but I apologize for that. There was nothing I could do. This is the room that I had, the equipment that I had, that I was able to schedule, and so hopefully this will just be a good lecture for you. If you can ignore those things, now that we've addressed the elephant in the room, we can just talk about ethics and how you apply ethics to your practice. How you apply ethics to your practice. So, to begin, well, you're probably distracted by these things, okay? So, I know you can see them, we'll get to them. We'll just address them right now. And hopefully you can read them clearly. Again, I wanted a room with a computer and a screen that could show you stuff, but at least I have a whiteboard with markers. So, let me just tell you what the objectives are of this guest lecture. And then at the end of our time together, you can see if we did in fact meet these objectives. Good? Okay. All right, so role conflict, you may have heard of that. We'll tell you what that is throughout the course of this lecture. But you'll be able to, at the end of this, our time together, my guest lecture, you'll be able to understand role conflict. You'll understand it, you'll recognize when you have role conflict in your practice. The second objective is value conflict. Value conflict. By the end of our time together, you will understand and be able to identify value conflict. Okay, those are our first two objectives. Understanding and recognizing role conflict in your practice, understanding and recognizing value conflict in your practice of social work. The third objective for this guest lecture is by the end of our time together, you will know how to apply ethics to practice. This is something that is super important. Even professionals, licensed professionals, LCSWs, SSWs, they struggle in knowing what to do with ethics. How they handle role conflict, how they handle value conflict, how they apply the NASW Code of Ethics, the Professional Code of Ethics, to their practice. You guys know what ethics are? I know I can't hear you. Hopefully you can hear me if our connection is good. Ethics. If you were to Google this on your smartphone, you might find ethics being defined as morals, a moral code, a standard of conduct. Those things are all correct. When I talk to you about the NASW Code of Ethics, I'm talking to you about the National Association of Social Workers Professional Code of Ethics. I'm explaining to you that the Guild, when I say Guild, let me write that out for you. G-U-I-L-D. Have you heard of a Guild? It's kind of a medieval term. We use it still now. It's an organization of, well, a long time ago, like an organization of maybe candle makers get together and they say, hey, we all belong to this union, this guild of candle makers, and we're gonna, this is how we know you have a quality candle maker because they're recognized by our guild. And if you get a candle maker from the Candle Maker Guild of the Kingdom of Shangri-La, then you will know and expect certain quality. The candle maker will be good, they'll be background checked, so on and so forth, and they will behave in this manner. Does that make sense? Maybe not the best analogy. I thought it was kind of fun to say, but let's just say now the NASW is a guild of social workers. Because we're a diverse group, right? We're a very diverse group. Some of us that are social workers maybe identify as a sexual or gender minority, right? Some of us identify as cisgendered, which just means that the gender we were assigned at birth, our sex being male or female, our gender, boy or girl, we identify as that. Our sex is male, we identify as male, and we're cisgendered. Some of us may belong to a religious minority group. In Utah, you have, it's kind of interesting because you have a majority minority. Mormons are a religious minority. I think the Pew estimate is 1.7% of adults in the United States identify as Mormon. If you took that same survey in Utah, then you would recognize that, well, probably more than 1.7% of the adult population in Utah identifies as Mormon. It's probably going to be more like 60%, I think was the poll I saw last. So, but religious minorities, still, some of us might identify as religious minorities. That would be Mormon or Muslim or maybe Jewish, right? There are social workers among those groups. Some of us may be an ethnic minority, right? Some of us may have a different national origin. Bottom line, we come from all these different backgrounds. We come from these different backgrounds, these different cultural groups, but we're social workers. And we need to have some kind of uniformity to how we behave, how we act, so that the public can trust us. So the public can know, hey, I'm gonna go see a social worker. What kind of social worker am I going to see? Does that make sense? Okay, so the NASW, the National Association of Social Workers, is a guild of social workers, and they have said, I'm going to use this brown marker, hopefully it shows up, right? They've said we have professional, is that showing up okay? I can see it on my screen, so hopefully you can. Professional values. Professional standards. In other words, ethics. Ethics. Okay? So that's what they wanted to do. The guild wanted to get together and define, hey, whatever your background is, you are going to act this way as a social worker. Okay? So you probably have gone over the NASW Code of Ethics. I'm assuming, since you're in field right now, you've had a basic ethics course and on professional ethics, that they've covered what the NASW wants you to know. Do you know that the Code of Ethics was initially revised in 2008, the most recent one, but now they have one that just got revised, released, and is now official now in 2018. There are a few changes. We don't have time to get into those today, but if you haven't reviewed the Code of Ethics in a while, I suggest you go back and look at it still. There's still the 6 sections with the different subsections. You start with section 1 all the way down to section 6. But in section 1 in particular, they have a few different subsections related to the internet and those kind of things. So make sure you check that out if you haven't already done that, depending on when your ethics course was. Just a reminder too, speaking forward into the future, when you are licensed, you will have CEUs, continuing education units, and you'll be required to get so many every 2 years in order to maintain your license. If you don't get those CEUs, you can lose your license or get in trouble for malpractice, and that's bad. Don't do that. But one of the CEUs you have to have is on ethics. So it's pretty important. And again, that's the values and standards that we are supposed to subscribe to as social workers. So let's go into this. Role conflict, okay? Role conflict and value conflict. These are kind of related sometimes. Remember how I just spoke to you about our different backgrounds, culture, upbringings, whatever? Well, most people have a background. I think it's fair to say this is a generalized statement. I know. There's a background of, hey, be honest. Or maybe you've heard of the golden rule. Have you? What is it? Yeah, do unto others like you would like them to do unto you, something like that, right? So just treat people nice, right? That's good, that's great. Well, maybe that's your background, but as a social worker, maybe you need to approach things differently. Let me kind of shift gears for a minute. Abortion, that's a social issue, right? Roe versus Wade back in the 70s, I believe, the decision was that a woman, at least in the United States, has a right to an abortion, which is the termination of a otherwise viable pregnancy, right? So there's a right to an abortion. Now, as a social worker, the Code of Ethics says, hey, we believe in self-determination. We believe in self-determination. When our clients come in, they can talk to us. They, not us, they get to choose what they're going to do with their life. All right? So maybe you have a 15-year-old girl come into, maybe you're a school social worker, right? You have a 15-year-old girl come into your office and say, hey, social worker, I am pregnant. I'm pregnant. And I'm kind of freaked out about being pregnant. You know, we used condoms, but something happened, I don't know. I'm pregnant. And I'm freaked out. Okay? All right. Think about that for a minute. Now, you know, let me give you some more background on this situation. Let's say for a hypothetical that the student that comes in, she has been an A+ student, seriously, like she has a 4.2 on a 4.0 scale. She's brilliant, and she plans to go to medical school. That's her plan. She's talked to you about it before, or at least the guidance counselor told you, you know that. She plans to go to medical school. Now, medical school is, well, in America anyway, you finish your high school degree, you get into college, you get an undergraduate degree, then you go to medical school. You have to have a bachelor's in place before you go to medical school. That's kind of, at least that's generally how it works, all right? So you're thinking, in this hypothetical, you're thinking, wow, the studies show that girls who become pregnant and give birth to their child and keep their child, raise their child, really struggle. They struggle in school. They struggle to advance. Their education is lower, their socioeconomic status is lower on average than women who do not do that, right? So you're kind of concerned about that. And you're thinking, you know, maybe it's best for her to have an abortion. Maybe that's your mindset, right? Maybe you're thinking, well, geez, if that was my daughter or whatever, I'd be like, hey, you know, don't give up your future. Okay? You with me so far? Okay, so you have some values here. Good, you have your own values. We all have our own values. And maybe you'll have some role conflict, right? Because as you talk to your client, and let's call her Billy. I call all my clients who I'm lecturing Billy, because that's a safe name, right? So you say to Billy, you know, Billy, what are your thoughts? What do you want to do? Because you're being careful. You're not just throwing abortion out to her. And she says, you know, I want to keep this baby. I don't believe in abortion. I think the baby's here. I think the baby deserves to have life. This is a human life. I think the baby deserves to live. Or maybe I'll raise the baby. I don't know. That's kind of where she's at. Okay, that's what Billy says to you. But you're thinking, I think abortion would be better. Can you ethically, here's my question for you. Can you ethically tell her she needs to get an abortion? Can you? You have to be really careful, right? You have to be really careful because the NASW Code of Ethics says, hey, clients get self-determination. The NASW Code of Ethics, I believe it's 6.04, and I apologize again, I can't just pull it up in front of you right now, talks about we have to, as social workers, understand the marginalization and oppression of different groups. sexual minorities, religious minorities, folks with disabilities. Maybe Billy has a religious background, she's a religious minority that doesn't believe in abortion. And so we have maybe a value conflict, right? Maybe our values are different than her values. But we cannot put our values on her. We can't put our values on her, right? So there's a value conflict there. And you have to be aware of that if you're going to be an ethical and competent social worker. Okay? Let's tweak this hypothetical a little bit. Maybe you have some role conflict, right? Role conflict. We talked about value conflict. That example kind of highlighted the values. Our values are different maybe than our clients' values. They're different. We could switch that. We could say, hey, maybe you are personally are opposed to abortion, but your client, Billy, wants to have an abortion. Can you say, no, don't do that? In both cases, you can give your client information, you can provide education. You have to be careful, though, how you do that. You have to be careful not to be imposing your values on your client, okay? That's value conflict. Role conflict. Your role is to be a school social worker, to help Billy out. What can you do? Maybe the principal says, hey, I want you to drive her to Planned Parenthood. Could you do that? I don't know. I don't know what the school says or what's happening there. But are you a transportation person? Are you a social worker at the school? Sometimes as a social worker, people will kind of throw things at you and say, hey, you deal with this social worky stuff. Now, I'm not talking about Planned Parenthood being good or bad. Planned Parenthood can be very effective in helping people understand about birth control, safe sexual practices. They do also have abortion. There's some controversy surrounding that in the greater society, right? There's been conversations about that. But the issue more is, well, what is your role? And maybe that wasn't the best example for you, okay? Maybe a better example would be your role is to take her to Planned Parenthood as a social worker. That's just part of your job description you got there, and you're a safe driver and you can, and the company that you're working with is paying for it. Do you feel comfortable with that? Do you feel comfortable transporting someone and not maybe doing social work stuff? Maybe there's a conflict there. Maybe you want to do more. Maybe you want to provide more education, or maybe you want to provide counseling and really help her understand what's going on. Make sure she has informed consent, but maybe you're not allowed to do that in the role that you have been assigned for the agency you are with. Maybe a better example is when, and this happens a lot to social workers, we're concerned. We're sometimes bleeding hearts. Now, I personally want you to understand that a bleeding heart is somebody that's so involved in everything that they get all emotionally caught up and kind of let logic fly out the window and just are caught up in the emotion of everything. I need to tell you, be careful, be careful. Don't be a bleeding heart, because bleeding hearts don't help the profession, and sometimes they don't help people. I work professionally in the ER as a crisis worker, as a mental health officer, and I have patients come into the ER and I provide mental health assessments of them and then give that information, my opinion, to the medical provider, typically the attending ER physician, right? So and they typically defer to me because I'm the mental health guy. The other night in the hospital, I had a patient come in who felt that the patient, Billy, right, was needing a break, had a lot of, had a mental health diagnosis of generalized anxiety and post-traumatic stress disorder, a verified diagnosis of those two mental health conditions, and also Billy was going under was under a lot of psychosocial stressors at that time. And Billy just felt that I need to come in. I'm worried that I'm decompensating. Oh, in addition, Billy had been non-compliant with the care recommended by his outpatient providers, his psychiatric nurse practitioner, his therapist. Billy was not following through with them, was not being compliant with medications, had started cutting his pills in half and taking homeopathic supplements, but not talking to the doctor about that. And then Billy had an exacerbation of his symptoms of depression, anxiety, and of course flashbacks with PTSD. And Billy said, I want to come into the hospital. I want to be admitted inpatient. Well, that kind of makes sense. Billy is decompensating. Billy is having some challenges. I'm aware of that, but guess what? My role is to do an assessment and to act as a gatekeeper, right? I need to act as a gatekeeper to determine who gets admitted to the hospital on an inpatient basis in a locked psych unit and who is safe to remain outpatient. Now, if someone has suicidal thoughts, maybe we should admit them to the hospital, but maybe not. There's a lot of people that think about suicide on a regular basis, and they do not need to be inpatient. Somebody needs to come into the hospital, generally speaking, if they are in an acute crisis. If they are actively suicidal with a plan, and if we don't do something to intervene, they are going to kill themselves. Or maybe they're going to kill someone else. I've had that too. Maybe they have active homicidal ideations with an identifiable target and they want to take that person out, and the only reason they haven't yet is because they haven't found them, and they're going to unless we intervene, right? So that at that time, the patient represents a substantial risk of harm to themselves or others. Or maybe the patient is actively, floridly psychotic. They are seeing demons chase them, and they just are fleeing, and they are not in touch with reality because they have psychosis of some sort, right? Or maybe they're using substances, they need to detox from alcohol. That's a very common situation I see in the ER. Backing up to Billy, who came in, right? Anxiety, PTSD, has a lot of psychosocial stressors. I do an assessment of Billy. I'm sympathetic to Billy, and Billy is not suicidal. Billy has no suicidal intent, no plan, isn't even thinking about it. Billy's not homicidal. Billy doesn't want to hurt anybody. No plan, no intent, not even thoughts about it. Billy's not psychotic. Billy's not seeing things. Billy's not hearing things. It's not happening. Billy's not using any substances. Okay? So Billy is stressed, is having issues and challenges, but based on my assessment and the information I had, Billy does not meet criteria. I can't give away a bed to Billy when I might have another patient come in who is gonna kill the neighbor. Okay, that happens. One of the deciding things for me was Billy had been non-compliant with his outpatient providers, and I had notes showing that they'd been reaching out to him, that he had an appointment for the next day, that he really was going to be taken care of by these wraparound outpatient services, right? So that was kind of the tipping point. Like, no, he needs to stay outpatient. That was a recommendation. Billy didn't like it. He really didn't like it. He's like, can I talk to the attending? Sure, you bet. Talk to the attending. Talk to the attending. The attending, for whatever reason, she had a soft spot for this patient. And she said, I just can't discharge him. I said, well, why? How come? I'm telling you this story because there's role conflict, right? I'm sympathetic to this guy. I'm a person. He is having a hard time. The attending physician wants me to admit the patient to a psych unit. But I had to say, you know what? Based on the criteria, he does not qualify. I can't put him in there. My job is to make a recommendation based on the facts that I have and my assessment. And based on those facts and my assessment, he doesn't meet criteria, so I can't put him in the hospital or put him anywhere. Is that a better example? Does that help you understand role conflict? Huh? So my job is to be a gatekeeper, admit people that have to be admitted in acute crises, right? Versus just admitting everybody. Could he have done better coming in patient? Sure, he might have done great, right? But that's not what I need to do. That wasn't the criteria that I had to go off of. So that's role conflict. I hope that helps. I hope that helps, okay? Value conflict again. Remember, you're a school social worker. Billy wants an abortion. You don't think she should have one. Or Billy doesn't want one. You think she should. There's a value conflict, right? These things are huge. They come up all the time. All the time. And sometimes they're kind of combined. You don't go, well, this is only a value one, this is only a role one. They're combined. Okay? Stay with me. That may have been a little bit confusing. Hopefully you're getting it though. Okay? Now let's talk about ethics to practice. And I'm gonna erase this because my board doesn't go all the way. My board keeps extending off screen and you can't see that. So I'm gonna erase this. Hopefully you were taking notes. Okay, all right. So here's the deal. How do you apply ethics to practice? Well, let me tell you the approach that I've developed that I teach my students at Utah Valley University, where I am an assistant professor of social work. I've taught them what I call the FOA. The FOA. Okay, I'll write it for you. So it's, we're still on, we're still on camera? Okay, good. Dr. Nielsen's FOA. Now you're free to use this, you're free to share it, just make sure you cite to me, okay? I'm working on an article on this too. It's very helpful. FOA, what does FOA mean? You're probably thinking, what is that? It's an acronym, okay? It's an acronym. Framework of Analysis. Did you see that? Framework of Analysis. The FOA, so it's Dr. Nielsen's Framework of Analysis. And let me write the steps for you. Okay? Good? Okay. Step number 1. Not really step number 1, but point number 1. What are the facts? What are the facts? Just looking at that camera lens to make sure you can see that. What are the facts? Now, maybe you've seen detective movies, people just want the facts. What are the facts? Let me explain what I mean by facts. I've heard this somewhere, I forget the source, but they talked about facts being truths, can you see that okay? Facts are truths frozen in time. They're truths frozen in time. So, something may be true now. We get more information, we figure more things out, and actually, no, it's a little bit different, right? A long time ago, I think around colonial American times, right, 1700s, it was competent medical practice to attach leeches to people and bleed them. Oh, their blood's bad, let's bleed them out. What do you think about that? Now, there are times now when maybe it's recommended that you get your blood cleaned. Maybe your kidneys are failing, right? So you need dialysis, so they take the blood out of your body and clean it and put it back in, whatever, right? But we're not just bleeding people out needlessly. We know that if you don't have blood, you die, right? If you don't have blood, you die. So the truth during the colonial period, the facts during the colonial period were bleeding helps. That was a truth frozen in time. As we got more information, we realized, that's not really true, okay? Maybe you're doing an assessment. You're assessing a client. I know you're probably at bachelor's level right now, so you're not doing therapy, but are you still assessing? Can you still assess? Yes, you can still assess. You're competent. You can maybe make recommendations. not diagnose and treat a mental illness, but you can make recommendations to therapists. If you're case managing, you can make recommendations, you can bring up concerns, you can do that. And in fact, that's helpful, I think, as a LCSW, when I have people give me additional information so I can know what's happening. Well, you can kind of pass some stuff on too. So what are the facts? Remember Billy, when we were a school social worker, Billy came in, Billy was pregnant. Facts are Billy's pregnant. Okay, we know that. So in any given situation, when there's an ethical situation you need to be aware of, you have my FOA, framework of analysis. The first part of that framework of analysis is the facts. What are the facts? Number 2, kind of goes in here, role and value conflict. I want to know what your reactions are. What are your values? What are your biases? You see that? Step number 2. What are your reactions? What are your values? What are your biases? What are you? What's happening to you? Here's the facts. How are you responding to them? You need to know who you are. You need to know what your stuff is. You need to know what your triggers are. Okay? You want to be ethical? You gotta know this stuff. Right? So that's the second step. Your reactions, your values, your biases. Some of you, when we talk about Billy not wanting to have an abortion, maybe you can relate to that. Well, yeah, of course not. Maybe some of you thought, what's going on? She's oppressed by society, this patriarchal society. I don't know. Maybe, but that's your stuff, right? I'm not saying one's right, one's wrong. I'm saying that's your stuff. That's our purpose here, right? You know what your reactions, your values, your biases are. This is the internal scan of what's happening with you, okay? Based on the facts. Got it? Number three. Code of ethics. Code of ethics. Okay? What code of ethics? Of course, the NASW code of ethics, right? So you don't need to have it in your pocket anymore. You can print it out if you want to, but you got a smartphone probably, right? Pull out a smartphone, look at the code of ethics. Maybe you're in an office. I like looking at stuff on desktops now because the screen's bigger, especially if I'm reading a lot of stuff. Smartphone's great for texting, whatever, or watching stuff, but reading lots of text-heavy stuff, it's not that great. Maybe it's just me. But you got it. You got access to the code of ethics, right? You have internet access. If you don't, maybe you can get a copy somewhere. But you want to be aware of what the code of ethics say. Okay? So you know what the facts are, you know what your actions are. Like the code of ethics we talked about, self-determination. Hey, we're big into self-determination, right? Section 1 is all about our ethical duties to our clients. Then we have section 2, section 3, they talk about our duties to the profession, to our colleagues, to our coworkers, to a greater society, right? That's kind of how it goes. So we want to look into the code of ethics and go, is there something that I should be aware of here? Let me give you an example. 1.07, if I remember correctly, right? 1.07 talks about confidentiality. Now, if someone comes and talks to you, you kind of got to keep it a secret. I can't just go and say, well, guess what so-and-so said to me. I can't do that, right? I have to keep it confidential, right? There's that standard there. There are some exceptions. If, for example, I have someone come in, they talk to me, and they go, I'm going to kill myself. Guess what I'm doing? I'm telling the attending physician I may need to alert the police, maybe not. But I'm using this FOA. What are the facts? They want to kill themselves. What are my reactions? Oh, okay, let's see where they're at here. That happens, I might need to lock them up. What do the code of ethics say? Hey, in emergency situations, you're okay. In some cases. Let me give you, well, I'll tell you about it in just a minute. I'll give you a hypothetical, okay? So that's the code of ethics. You want to kind of review what's going on. 4, you are going to have some guidelines. Hold on. I'll do this. Agency Can you see that okay? Agency, guidelines and procedures, okay? Guys. Yeah. So your agency probably has, and they should have, guidelines and procedures about what's going on with them. Okay? That's what they need to figure out. And you should have been taught some of these things. Maybe your agency says, hey, we never transport clients if they have to be transported by family or themselves, or maybe a third-party transporter like Guardian Transport, where they can bring people to their appointments or whatever, right? Kind of a basic example. But you need to know what those are. Do you have a supervisor? Yes, you have a supervisor. You have a field instructor, right? You have a social worker in the field, in charge of you, that you report to for your field placement, your internship, your practicum, whatever you're calling it. Yeah? They should know these things. If they don't know, they can talk to their supervisor. You guys can pull out the dusty books or look online, see what the mission statement, all this other stuff is. That's relevant to your framework of analysis. Okay? And let me go here. Number 5 is the law. The law. Okay? And I want you to think about Tarasov. That's a case that people cite to all the time about the duty to warn. If you have a client who you know is targeting someone, your client wants to kill that someone, is an identifiable third party, you may, not always, but you may have a duty to warn that third party. Okay? You may. I also want you to think of not just this law here, but also cross-examination. Now, I didn't do a bio when I started. I just was so excited to talk to you, but I should have told you I'm a licensed clinical social worker, so I'm an LCSW. I am also a licensed attorney, in addition to being a professor, right? I'm licensed in California, in Arizona, and in Utah. And before I entered academia and decided to be a professor, I was practicing law full-time. I did a lot of family law cases and also child custody cases and the termination of parental rights, and I cross-examined so many social workers, and sometimes I made them cry. I didn't mean to. I mean, I was good as a lawyer. I wasn't being rude, but I was cross-examining them to say, hey, why did you do what you did? Why did that make sense? Why are you doing this? What's going on? Did you think this? Why'd you do that? You know? So I want you to be aware of when you make a decision, could you defend it in court? Could you have a clinical rationale, a justifiable, defensible rationale for why you did what you did? Why you made the decision you did? You need to have that. You need to be able to articulate, to explain why you're doing what you're doing. Now this FOA, this framework of analysis, will help you. It will help you, I promise, if you apply it. I do have to say, I taught this to some professionals. I did a team teaching thing where I taught the first hour and a half, then my colleague taught the second hour and a half. I taught the framework of analysis, and then we just got through with my presentation. We went into the second presentation. They asked a question, and I was sitting at this table. Okay. Someone just told me my time's almost up. I was sitting at the table, and they said, how do I deal with this ethical situation? My client comes in, and Billy wants to transition. A female wants to take female hormones. I'm concerned about this because Billy's 13. I don't know, right? That was the question. So I have to wrap this up, but quickly, this is what's going on. The person should have just applied the FOA. What are the facts? Billy wants hormone replacement therapy. What are the reactions? It concerns the therapist. Code of ethics, what do they say? Self-determination, go through there, see what's going on, right? Agency guidelines, they're there. What does the law say? What does the law say? You may not know the whole law, but you will know enough to get by, okay? If you follow these 5 steps, you'll be okay. Now my time is up for this room. I'm gonna get kicked out of here. Just a reminder, we talked about role conflict, what that is, how to recognize it. We talked about value conflict, what that is, how to recognize it. We've talked about how to apply ethics to practice. Do the FOA, the facts, reactions, the code of ethics, your agency guidelines, and the law. Thank you very much. I wish you the best going forward. You're great social workers. Thank you.